A very pleasant good afternoon to all of our viewers and those listening on Second Advent Radio. We welcome you to another edition of Let's Talk. Today, we are going to be continuing our discussion. For the past few weeks, we have been talking about taboo subjects, particularly in females, but this afternoon we're going to be dealing with males. Specifically a male issue, but of course we want the ladies to pay attention because you will discover that this has significant implications for you as well, especially for married folks. Last time we discussed the subject of sexual dysfunction. We did not get the opportunity to go in depth into the aspects relating to male sexual dysfunction. And so this afternoon, we are going to be talking about sexual dysfunction in males. Before I introduce our guests, I would like to invite you to bow your heads for a word of prayer. Shall we pray? Eternal Father, be with us as we go on to this very important subject this afternoon. We thank you for the opportunity to share with our friends and viewers around the world, and pray that as we discuss today, that the information will prove meaningful. Be with our guest in a very special way, give him wisdom and clear articulation, help that our systems, the technology will work well, and that everything will just be done in accordance to your will. Thank you again, in Jesus' name. Amen. So friends, welcome again to Let's Talk. We, as I indicated before, did not go in depth last time with the subject of male sexual dysfunction. And you may recall way back in early October when we started discussing the subject of taboo issues. One of the first things we dealt with was the whole concept of menstruation and sexual dysfunction. And one of our guests was Dr. Goodell Thom. Well, he's back with us this afternoon. We want to welcome him, and he is going to be guiding us through this very important subject of male sexual dysfunction. Dr. Thom, it's a pleasure to have you on Let's Talk again. Welcome. And just say a word of greetings to all viewers and listeners. I think you are muted.
Yes. Dr. Greene, thank you for having me, and it's a pleasure being here. I would like to say good afternoon and happy Sabbath to your guests. And I know that we would have quite a good discussion today, and we'll explore male sexual dysfunction in some detail.
Yeah, well, we want to go straight into the subject because, as you know, time goes by very quickly. The last time we discussed this subject, we touched on the female but did not go in depth with the male. I want to begin by asking you, how common is the problem of male sexual dysfunction?
Very good question. Sexual dysfunction, as you rightly mentioned, can affect individuals of any gender, but the prevalence of male sexual dysfunction can vary depending on factors such as age, health condition, lifestyle. It is important to note that sexual dysfunction is a very broad term, and it includes various issues such as erectile dysfunction, which is difficulty achieving or maintaining an erection, premature ejaculation, and low libido or libido. The prevalence of male sexual dysfunction generally increases with age. According to one very good study out there, Massachusetts Male Aging Study, about 40% of men age 40 experience some degree of erectile dysfunction. And this percentage increases to nearly 70% in men age 70. However, I must give a word of caution here. And that is that these numbers can vary, and different studies do report different prevalency rate. Additionally, the definition and assessment of sexual dysfunction can vary. making it challenging, very, very challenging, to establish a precise prevalence. Many men may also experience occasional difficulties without meeting the actual criteria for a diagnosis of sexual dysfunction. And so if you put all of that together, we can come up with this. All of the studies agree on this. Sexual dysfunction begins at certain age as you get older, and the prevalence tends to go up. Prevalence tends to go up with age.
Now you mentioned a few things there that I hope we can go into a little more
certainly
detail a little later
as we
on.
go on.
Yeah, very, very interesting indeed. But just to say that you're saying that as one advances in age, I remember talking to a gentleman who was, I believe he was 88, and he said, "Man, I'm still functioning well." So there's hope. There is hope. Okay, well,
certainly there is.
now, when we say sexual dysfunction, what exactly do we mean, and how does it manifest itself?
Excellent question. You're coming up with some very good questions this afternoon. Sexual dysfunction refers to a difficult or a problem that prevents an individual from experiencing satisfaction or pleasure from sexual activity. So there's some difficulty or there's some problem that prevents the individual from experiencing satisfaction or pleasure from sexual activity. Now, this can encompass a wide range of issues that interfere with any phase of the sexual response cycle, including desire, arousal, orgasm, and resolution. So sexual dysfunction can affect, as we all know, both men and women, and it can be caused by various, and I hope we'll get time to go into this, physical, psychological, or interpersonal factors. Now, you ask an important question in the end: how does this manifest itself, or how does it present itself? Now, let me give you a few ways in which male sexual dysfunction can present. One that is very common is erectile dysfunction, or ED. This is the inability to achieve or maintain an erection sufficient enough for sexual intercourse. It can be caused by a number of factors. We'll look at some of those later on. Then there is premature ejaculation, or PE. And this involves ejaculating sooner than desired, often with minimal, very, very minimal sexual stimulation. Again, there are a number of factors that can cause that. Other sexual dysfunction that are not so often thought of is delayed ejaculation. And this is characterized by a significant delay in or the inability to achieve an ejaculation, even with sufficient sexual stimulation. And again, there are factors that can cause that. Then there's one that is called hypoactive sexual desire disorder. A lot of big words there, but basically it means low sex drive, low libido or low libido. This refers to a reduced or absent interest in sexual activity. Again, there are several things that can cause that. So those are some of the kinds of male sexual dysfunction that exist. And I hope I answered your question there.
I just want to ask you a follow-up question based on what you just shared there.
Yes.
I believe you mentioned, and I'm going to use this simpler term, low sex drive.
Yes.
Because we're talking about men, people don't normally associate low sex drive with men. But you're saying that this does happen sometimes.
Yes, it does. And it is one of the many different kinds of male sexual dysfunction that there is out there. And I guess sometime later on, as we go on in the program, we can talk about some of the things that can actually cause that.
Well, actually, I want to go into you know, some of the causes right now, some of the things
All right, okay. So there are various factors that can cause low libido and or low sex drive, hypoactive sexual desire disorder, as it's called, DSM. And so, what are some of the things that can do that? There are things like hormonal imbalances, stress, relationship problems, and of course, there are certain drugs and certain medical conditions that can contribute to that. So there are a number of things out there that can cause, low sex drive.
Now, I just paused to look at the, some of the things that viewers are saying, and one person is highlighting that they are happy that we are discussing males this afternoon because sometimes the men feel left out. So I'm happy, Dr. Thornton, that you're here to highlight some of these things. Now, if you could just, now you indicated there a little bit a while, I believe you were talking about the whole concept of causation, right? Some of the things that cause these things. And
yeah, we were specifically, Dr. Greene, we were specifically talking about, those things that cause, as you term it, and as the layperson would put it, and very easy to say and to remember, what causes low sex drive.
Okay, now, but do you mind talking about some of the other causes? Some of the causes.
Okay, things that causes
in general.
Yes, exactly. So male sexual dysfunction can be caused by a variety of factors, as we all know. And it often involves a complex interplay of physical, psychological, and interpersonal elements. And let me just give you a view of some of those things that can commonly cause male sexual dysfunction. For example, let's look at the physical or health issues that are or can be associated with male sexual dysfunction. One would be cardiovascular conditions. These are your conditions such as your arteriosclerosis, which is hardening of the arteries. And this can cause restricted blood flow to all the organs that are important, including the genitals, and it can in that way contribute to erectile dysfunction. Then there is diabetes, which can affect nerves as well as blood vessels. Again, that would and can lead to sexual dysfunction. There are some neurological disorders, conditions like Parkinson's disease, multiple sclerosis. These can impact nerves. And again, if the function of the nerve is impacted, then it can also affect and cause male sexual dysfunction. And then if we go down the list of health issues, there's hormonal imbalances. And these are things like your low testosterone levels, and that can contribute, one of the things that can contribute to low libido or low sex drive. And it can also cause some erectile dysfunction. And then there are some medications out there. Medications including certain antidepressants, some high blood pressure medications, some sedatives that can have side effects that affect sexual function. So on the physical or health issues, those are some of the things that can cause sexual dysfunction. When we talk about the psychological factors, this would include things like stress and anxiety. High levels of stress or anxiety can interfere with sexual desire as well as sexual performance. And I hope I will be coming back to some of that later in the course of the hour. Then there is depression. And since COVID, we understand and people are understanding more now the whole idea about depression and what that is and the impact that depression can have on one's health. Now, depression is often associated with changes in sexual desire as well as sexual performance. So depression is a very important one there. One that we all should take note of, and very important, because you can have probably none of those things that I mentioned before, but if you have this one that I'm going to mention now, that can cause problems, and that is performance anxiety. Worrying about sexual performance can contribute to difficulties in achieving or maintaining an erection, resulting in sexual dysfunction. So we talk about health, we talk about psychological. Let's look at relationship issues. Now, communication problems. If there is a lack of communication, or if there are unresolved conflicts in a relationship, this can and does oftentimes impact sexual function. There need to be that open communication. Intimacy issues. And there are a number of people, because of things they experienced in the past, things like that, that does cause issues with intimacy. And emotional intimacy is often connected to sexual intimacy. And so problem in one area can affect the other area. The other broad category of things that can cause sexual dysfunction is lifestyle factors. So we're talking here about things like smoking. We know that, and it's easy to connect this, because we know that smoking can contribute to cardiovascular issues, and that can affect sexual function, like I mentioned earlier. Excessive alcohol consumption, like chronic alcohol abuse, this can also lead to sexual dysfunction. Illicit drug use can have various negative effects on sexual function. Lack of exercise, sedentary lifestyle, this can contribute to obesity and cardiovascular issues, again, ultimately affecting sexual health. And then, as I mentioned previously, age-related changes is something that we need to consider. As men age, there may be natural changes in hormonal levels, natural changes in blood flow contributing to sexual dysfunction. I hinted about that a little earlier. And then there are psychosocial issues, cultural, religious beliefs. There are some personal and cultural beliefs about sex and sexuality that can influence sexual function. Now, I don't know about you, but there are some terminologies that I have heard growing up about sex that were not wholesome. I recall, at least in Guyana, people would refer to sex as wickedness. So sometimes, and I guess different parts of the Caribbean, people have sometimes these connotations and beliefs that are associated with that. And then there's past trauma. Previous traumatic experience can affect sexual health. And note on one's overall health. So if you have underlying medical conditions, chronic medical conditions, kidney disease, liver cirrhosis, all these things, they can affect one's sexual function. Hence, they can lead to sexual dysfunction. I heard you were wanting to say something there, Dr.
Yeah,
Greene.
you have said quite a mouthful there. So many things that I would really desire to expand on. But I want to go back to the matter of one of the things you mentioned before you switch to the psychological issues was medication and the side effects of medication. And I feel impressed to just ask you to say a bit on this, because if I'm sick and I go to the doctor, and a lot of people don't seem to understand some basic things they need to do when they go to a physician, They go to a doctor, he or she writes a medication, a prescription, and they go and they take it without asking the doctor what are the side effects, how does this work? Or these days even go and do some research. But if you are indicating that some medications may have side effects to interfere with maybe hormonal imbalance or desire or something to that effect, so could you just expand on that a little bit?
See, I'm definitely going to expand on that. However, I want to clarify something here. I want to state this clearly. If you're on any medication, I would advise you, before you decide to stop your medication, to have a frank discussion with your physician or with the person who's providing you with care. It's very important that you do that. I don't want anybody to leave this afternoon and say, no, I'm not going to take this medication. I'm not going to take that medication. I'm not, don't do that, please. However, on the other side of that fence, Dr. Greene, we normally encourage physicians to have those discussions with patients, because sometimes what happens is that you're treating a patient for a condition and you're not seeing any change. And the reason why you're not seeing any change is because the patient is no longer taking that medication. And why the patient is not taking the medication is because of those reasons that I mentioned. Some people realize that, hey, I'm taking this medication, and since I start taking this medication, I have performance issues. I have, dysfunction, sexual dysfunctional issues. And so they would stop taking the medication. And so if you don't communicate that, and if you remember very early in the spiel here, we talked about having communication. Communication here is, and I guess throughout this whole discussion for this hour, you would understand the importance of communication. It's communication with your spouse, that intimate partner, communication with people who are providing your medical care. And sometimes it may even involve communication with a therapist or or someone who is directly providing some care or treatment management of your sexual dysfunction. So yes, there are some medications, including antidepressants, like I mentioned, that can cause sexual dysfunction. There are some high blood pressure medications, like your beta blockers, like your diuretics, that can cause sexual dysfunction. There's some sedatives that can do that, that can, they can affect sexual function. And the way you're going to notice is by asking that question, please. If you're put on a new medication, ask. If you're interested in that aspect of your life, ask. So, doctor, you're putting me on this medication. How is this going to impact my sex life if I start taking it? That's an important question. If it's important to you, ask it.
I suppose as you're speaking there is, and perhaps this is more cultural and general, but in some cultures, people are just simply afraid to discuss the subject of sex. So it would not surprise me if somebody is a little intimidated to say to the doctor, how will this impact my sex life? But what I hear you saying is that these are things that we need to speak about. Correct.
Yes, Dr.
I just want to also reiterate here, what I hear you saying is that if you are taking a medication and you experience some kind of side effect or something you think may be a side effect, don't just stop taking it and not communicate to your physician. Say to your physician, I observe so-and-so, so, for this reason, I don't want to continue this. That sounds to me like...
Yeah, you can ask them, do you have an alternative? Doctor, or whoever, I realized that since I started taking this medication that you provide, and I'm not going to call a name here because I really don't want people to go stop taking their medication.
Yeah.
But doctor, I since you prescribed me this medication, I realized that I'm not, performing the same way like I usually do. Is there something in this medication that can cause that to happen? And if the answer to that is yes, is there an alternative that I can use that wouldn't have that problem? And, if it's a matter of life or, sexual performance, you would have to make that choice. I hope you choose life, but it's a choice you would have to make. But a lot of times there are alternatives, and a lot of times there's something that a doctor can or should be able to do to assist in that area.
Very well, very well. Now, in as much as I want to ask follow up on a lot of things, I'm looking at the time and realize that we're almost halfway through. So let me proceed. But in fact, you spoke about. I want to deal with some of the behavioral causes that you highlighted. How do things like smoking and alcohol and obesity work to cause sexual dysfunction?
Very good question. Very good question again. So alcohol, tobacco, drugs, obesity, things like these, they can all contribute to sexual dysfunction. And there are various mechanisms affecting both physical and the psychological aspects of sexual health involved here. And for example, if you look at alcohol, for example, alcohol in the medical world is known as a central nervous system suppressant. So, in other words, alcohol suppresses or depresses the central nervous system. So, we all know about the impaired judgment, right? But apart from impaired judgment, it also causes decreased arousal. And it can delay or inhibit sexual response. So that's a big one for alcohol. The reason for that is excessive alcohol consumption can lead to cardiovascular issues. If you really look at this, and someone is consuming large quantities of alcohol over a period of time, that can result in cardiovascular issues affecting blood flow to the genitalia. And once that happens, because we need that blood flow in order for erection to take place. So once that happens, that would result in erectile dysfunction. Another thing alcohol does is that chronic alcohol use, and again, I'm mentioning the word chronic because I don't want people to believe, and I'm not going to sit here and tell you that, okay, you go out there and you take what they call one shot of alcohol, these things are going to happen. But chronic alcohol use can also disrupt your hormonal balance. And that includes testosterone levels. So if you're going to be chronically drinking alcohol, your testosterone levels are going to decrease. And if that happens, then that would impact libido and sexual function. Hence, alcohol contributing in these different ways to sexual dysfunction. Let's look at tobacco then, because I think I mentioned a little bit on alcohol there already. Tobacco in itself causes vascular constriction. When we talk about vasoconstriction, we're talking here about narrowing of the blood vessels. If you narrow the blood vessels, you're actually reducing blood flow. If you reduce blood flow, and you're realizing the theme here, if you're reducing blood flow, that would contribute to erectile dysfunction. And then in the cigarette that you smoke, there's a high percentage of nicotine, right? There's significant nicotine in it. Nicotine, which is a stimulant, and it's found in tobacco itself, can also have a negative effect on sexual arousal and performance. So these are all things that, affect sexual function in that way. You mentioned obesity. And again, with obesity, there are several factors here. Let me just mention 3 of them broadly. So one would be your cardiovascular health. I mentioned that before in relation to other things. So your cardiovascular health as it relates to obesity. So persons who are obese often have associated cardiovascular issues. They have arteriosclerosis, they have high blood pressure, all these things that we talk about that impede blood flow. And once you start talking about constricting, impeding blood flow, then the genital area would also be targeted, would be included in that. And then you have erectile dysfunction. But then there's more. With obesity, there's an associated hormonal changes. So obesity, just because of obesity, is associated with it. It causes, kind of contributes to hormonal changes. So that disruption in the hormonal balance, including reducing testosterone levels, increasing estrogen levels, would potentially affect libido and sexual function. Not to be overmissed and not to be missed, when we talk about obesity, very important is this psychological factor or the psychological effect of obesity. Now, body image concerns and self-esteem issues related to obesity can contribute to psychological factors affecting sexual health. So it's important to note that the impact of these factors on sexual dysfunction can vary from person to person. Additionally, these factors can interact with each other. So with each other, contributing to their individual, exacerbating their individual effects. So you may have more than one. The combination can make things even worse. So addressing lifestyle factors such as reducing alcohol consumption, quit smoking, avoiding illicit drugs, maintaining healthy body weight through diet and exercise, these all contribute to overall sexual health.
It seems to me, Doc, as though one needs to definitely, for several reasons, pay attention to his or her health. And you know, we have discussed things like alcohol consumption. We have discussed obesity and overweight on this program before. And we are seeing additional reasons why one needs to give attention to these things. You know, I wonder sometimes why it becomes so easy for the kinds of food that promote ill health are the things that seem to be very easily accessible. But I suppose that's another discussion.
Yeah. You know, the things that sell are not necessarily the things that are good for your health, because those are the things that appeal to your very basic of mental functioning. So, you know, fat, sugar, and salt, those are the things that sell. Put it in any combination and they're not good for your health.
Yeah, that's right. Well, you know, another thing, maybe you may want to call this a follow-up, but what I sense from what you're saying there is that one's behavior in his youth can, and I said his simply because we're talking about male sexual dysfunction here, but one's behavior in his youth can significantly affect his sex life in later years, correct?
Certainly, Dr. Greene, certainly. You know, the types of behavior and lifestyle choices made during youth can potentially have long-term effects on sexual health in later years. Let me just give you some example of some behaviors that can influence sexual health. We've mentioned some of these. Smoking and substance abuse, right? So again, tobacco, illicit drug use can have negative effects on blood flow and overall cardiovascular health. Remember, if you're decreasing these things from your youth, then you're priming yourself for erectile dysfunction. They can contribute later on to erectile dysfunction in life. Again, excessive alcohol consumption. The impact of chronic alcohol abuse can lead to cardiovascular issues, hormonal imbalances. I can't overemphasize these things, both of which contribute to sexual dysfunction. Poor diet, lack of exercise, the impact of unhealthy lifestyle choices, including a diet that is high in processed foods and lack of physical activity. These all contribute to obesity, right? And associated very closely with that, almost married to obesity, is cardiovascular problems. And these are all linked to sexual dysfunction. Mental health issues. If that goes untreated and it's poorly managed, can also, issues like depression, anxiety can affect sexual desire and performance. So these are things that we need to look at and make sure that we're making these choices. And again, some of the things I mentioned here, like mental health issues that I just mentioned, I need to say that, I know there's a stigma associated with it, but the earlier one reach out and get help with these issues, it helps. Another thing from very early in life, Dr. Greene, you didn't mention this in your drugs and stuff like that, but it's the dynamics in a relationship. So from very early on, there can be unhealthy relationship patterns. Just absolutely horrible, poor communication, traumatic life experiences in one's youth. These things can have, future sexual relationship and sexual satisfaction, impact on sexual satisfaction. So it's essential to know that while these behaviors can potentially impact sexual health, all of those that I mentioned, the individual experiences vary. And not everyone who engages in these behaviors are gonna, have sexual dysfunction in later years. Genetics, overall health, and other life factors also play significant roles. However, Dr. Greene, on a positive note, and I want to throw in some positivity here. If one adopts now, you're listening to me now, or you listen, if one adopts a healthy behavior pattern now, or if one starts adopting healthy behavioral patterns in their youth, this can contribute to better sexual health later in life. So, this would include things like maintaining a balanced diet, engaging in regular physical activities, addressing mental health concerns, whether it's through therapy or counseling, whatever. So if one engage in these positive behavioral things now, you reap the benefit of not having to go through sexual dysfunction and the problems associated with that later on in life. So there are obvious benefits to having a healthy life style right now or in your youth.
So if one is married, I can see the wives encouraging their husbands to enact certain lifestyle changes. A wife may have a husband who is tempted to stop by Kentucky or the fast food place, let me not call names, and she may say, listen, honey, you're gonna have to cut out that, we're going to need to eat some home cooked meals that I can be sure of what you are eating. So that kind of partnership, I think it's useful for
very useful.
Yeah. Doc,
the partner plays a very important. I'm just expanding a little bit on your point here, Doc, and that is that in these kind of situations, communication, like I mentioned, play a key role, and one need to communicate. We hardly do a lot of times, and that's where the problem is, and that's why people continue down this road into problems. So communicating, the benefits of avoiding junk food or fast food, engaging in physical activities, and you can do some things together, right? You can start preparing meals together. I think that's very romantic. Personally, I think that's a huge thing. It's good, prepare. I know people. The guys say I come from work and I'm tired, and I am not one that believes that the female in the relationship should be the one always in the kitchen. And so both people being in there, this, I know this is a little off, Doc, but spending time together doing things like that adds later on to this whole sexual experience. So I think, find time to walk together, find time to prepare meals together, plan it out together, and see you get to that point where you want to get to in the kitchen of the meal together. It does help.
Well, that's very, very useful advice. You almost sound like a marriage counselor there. Um, you know, I want to just follow up on another something you said there. So this next question I think is an important one, connected to what you said before. But it's really about the whole concept of sexual dysfunction and its impact on a man's self-esteem. When he discovers that he is not able to satisfy his partner, how does that impact his self-esteem?
Wow. It's huge across the globe. I guess for somebody who is living in a Caribbean setting, it's even more significant, because I don't know if you know, because I mean, you're a doctor and a pastor, but there are songs that are related to, men not performing well. And these are all derogatory. There are terms and things that are used. So sexual dysfunction can have significant impact on a man's self-esteem. The connection between sexual function and self-esteem is complex, Doc, and it can be influenced by various factors. Now, what are some of these factors? There's performance pressure. I mentioned a little bit about that. I know I would have some time. So here's it. Men often feel societal and personal pressure to perform sexually. And the inability to meet those expectations can lead to feelings of inadequacy and self-doubt. Now imagine, not only that, but this pressure can now be exacerbated, can be made worse by what I just mentioned, the kind of culture that we grew up in, right? How the media, now the songs and all these things portray masculinity. So add that to that mix and you have that performance pressure, that's the powder keg. Then the effect on self-worth and identity. Sexual function can be closely tied to a man's of his self-worth and his identity. So difficulties in the bedroom may lead to one questioning one's masculinity and this overall value as a partner. Then there is that relationship strain, and sexual dysfunction can contribute to relationship difficulties. And the strain on intimate connections can negatively impact self-esteem. A man may feel responsible for any relationship challenges that arise from sexual issues. Then, as I mentioned, there's the social stigma, right? So there can be a social stigma associated with sexual dysfunction, which may lead to feelings of shame and embarrassment. And this stigma can be a barrier to one seeking help and discussing concerns openly. I mean, think about it. This is not the easiest of topic. Like, I mean, you mentioned just the fact that someone earlier in the discussion taking a medication that may affect their sexual performance, right? Sexual health, not feeling open to talk to a doctor about that. Imagine the embarrassment and shame from what we call chronic sexual dysfunction. And then emotional well-being. So sexual dysfunction can contribute to feelings of frustration, anxiety, even depression. And these emotional states further erode self-esteem and impact one's overall mental well-being. So we're in a cycle here. And there's another cycle that can occur with this, and that's a cycle of isolation. So men experiencing sexual dysfunction may withdraw from society and from social and intimate interactions due to fear of judgment or fear of rejection or whatever other fear that is normally associated with that. This social isolation can now contribute to a sense of loneliness, which can negatively impact his self-esteem. So it's important to note that the relationship between sexual dysfunction and self-esteem is bidirectional. Low self-esteem can contribute to sexual difficulties, creating a cycle that can be challenging to break without an intervention. So addressing sexual dysfunction often involves and should involve a very holistic approach that should consider both the physical, the psychological, and there should be open communication with one's partner. There should be mutual support, and this is something that, I'm talking here predominantly to married people, I assume. And so there should be a willingness to seek help together. And I think that support would help to mitigate the impact of sexual dysfunction on self-esteem while fostering a healthier overall relationship.
And the reality is too, it's not just the impact on a man, but it can also be a frustrating experience for the woman likewise. But yes, our time is running. In fact, we only have about 12 or so more minutes, and I do want to get to the aspect of treatment. But before we do that, there may be one or two persons who join this conversation late, and I want to ask this. You did mention some aspects of this before, but especially for the benefit of those who are now joining, what is the difference between erectile dysfunction, that's ED, and PE, premature ejaculation?
Okay, good question. Very good question. So erectile dysfunction, ED, and premature ejaculation are both sexual health concerns, right? But they involve different aspects of the sexual response cycle. Let me give you some of the difference between erectile dysfunction and premature ejaculation. For erectile dysfunction, this refers, and I mentioned this earlier, refers to and I'm going to include this word here. It refers to the consistent inability. And notice I said consistent before I say inability. So it refers to the consistent inability to achieve or maintain an erection sufficient enough for satisfactory sexual performance. And so you would ask, well, doc, what are some of the symptoms of that? So men with ED, erectile dysfunction, may have difficulty getting an erection or maintaining an erection long enough for sexual activity to take place. Or sometimes, unfortunately, there's both. And then you asked me this before, and I'm just going to briefly, you said for the benefit of those that just joined. So what causes this? What can cause that? And some of the causes we did mention before. There can be physical causes such as vascular issues, hormonal imbalances, neurological problems. And, these can be influenced by different things like your psychological, social factors, including stress, anxiety, relationship issues. We talk about those, right? We also said that ED can affect a man's self-esteem. It can affect his relationship, his overall quality of life. So, and we also said that as one becomes older, it's more common with age. But I do not want you to leave here thinking that ED is considered a normal part of aging. It's not. So I'm not saying that at all. What I'm saying is that you may just more commonly find it there, right? As one ages, but it's not necessarily part of aging. I'm not saying that at all. The next one is you ask is premature ejaculation. And let me give you the definition, or what I characterize definition of that is. And that is the persistent, and I'm using these words because, you know, you may get one off here, one off there. So that's not what it is. So we're talking here about a persistent or recurrent ejaculation that occurs with, as I said before, minimal sexual stimulation before or on or shortly after penetration, or before the person wishes to ejaculate. Symptoms of that: men with PE, they may ejaculate within a minute of penetration or even before penetration occurs, leading to a lack of control over ejaculating, the timing of ejaculation. What causes that? There are several factors. We talked about these before. You know, we talk about things like the psychological, some of the same things that contribute to your erectile dysfunction are things that can contribute to your premature ejaculation. Premature ejaculation often leads to problems with the couple. So you can have, and you mentioned that, Doc. So it can lead to frustration. There can be stress. There's dissatisfaction for both the individuals, and it does affect the quality of the sexual relationship, and sometimes, you know, the entire relationship. And there's a lot of emotional stress that is involved. Again, very important to note, ED and PE, erectile dysfunction, premature ejaculation, they're distinct conditions. They can coexist in some individuals, but they're distinct. Additionally, the causes of both these conditions can overlap, with psychological factors playing a role in both cases. So we need to know that.
Now, Doc, my next question, in fact, there are a couple of questions from viewers, and I want to couple it with something I was going to ask you, because I really wanted to ask you about pornography and whether it has an impact on premature ejaculation. But there is a question that is similar. What about guys who practice masturbation? Can that present problems later on in life? So again, in the interest of time, I'm coupling these two together. I don't know whether they connect together. So
I will try to couple them, Doc, to the best of my ability here. So the relationship between pornography, the relationship between masturbation and premature ejaculation is complex, and I want to let you know that those are highly debated topics in medicine. There are some individuals out there, there are some reports where there's a connection, or there's a connection made between frequent pornography use and difficulties with sexual performance. Same for masturbation. And this would include issues like premature ejaculation. However, as a medical profession, it is crucial that I tell you that the relationship that is out there is not universally agreed upon. And so, from what I have read and seen, it seems like there's some variation in the experiences of different individuals. And so individuals may have widely varying experiences. However, there's one thing to me that stands clear, and that is, it, in spite of all the research out there about this, seem to suggest one thing, and that is the excessive use of pornography, masturbation, may potentially contribute to sexual performance issues. And these issues are varied. For example, there could be issues of desensitization, for example, unrealistic expectations, and there is one that I mentioned previously, performance anxiety. So these are things that are associated with masturbation as well as with the use of pornography.
Now, somebody's asking, where does, let me bring this in. Where does low ejaculation or no ejaculation fall?
So remember, when we talk about the different kinds of sexual dysfunction, one of them, remember, we mentioned one of them that was having to do with exactly what that person is asking about, and that is delayed ejaculation, and I guess that's what they're referring to.
Okay.
So when we talk about delayed ejaculation, we're talking about, having this inability to achieve ejaculation. It's not one of the most common male sexual dysfunction, but it's something that's out there. So I want to put it out there so you know it's out there.
Okay.
And the most likely cause of delayed ejaculation or failure to achieve ejaculation, the most common cause of that are patients on certain medications, or some neurological issues. So those two, delayed ejaculation, not being able to achieve ejaculation, those can be caused basically from some neurologic conditions can cause that, as well as there are a few medications out there that can cause that. So again, communication. You should know, if you notice after starting a new medication, and these discussions, they're best had when you're receiving a new prescription. This is something you've never taken before. Have those discussions. Talk to your doctor about that. And have that discussion. If this is something new and you're not on any medication, it may be. I think you would have other things too, but if that's the case, though, it means that there's something that you need to bring up with your doctor. It could be a sign of a neurologic condition that is going on.
Well, Doc, let me ask you this, because our time is almost up. I want to jump to treatment. What can a man do if he's experiencing, any kind of these sexual dysfunctions that you're talking about?
All right. So, in other words, what are some of the effective treatment for male sexual dysfunction that are out there? Yes?
Yes.
So, treatment for male sexual dysfunction would depend on the specific type of dysfunction as well as its underlying cause. So let's look at them then, because we talked about some specific sexual dysfunctions. So let's talk about it. So there's the erectile dysfunction. What are some of the things that can be done for someone who has erectile dysfunction? And so we know there are drugs, and there's some drugs that can be taken orally, that is by mouth. And there are drugs like sildenafil, which is Viagra, tadalafil, which is your Cialis, vardenafil, which is your Levitra. And these are commonly prescribed drugs. And what do they do? The same thing we've been talking about over and over. They enhance blood flow to the penis, and so they facilitate erections. So oral medications. Some people, because of whatever the cause is, and we mentioned there can be several reasons why someone would have erectile dysfunction. And so depending on the cause, depending on the background, oral medication might not be enough. And so for some people, there is what is called vacuum erection devices. Vacuum erection devices, these are devices that create a vacuum around the penis. And so it draws blood into the area, and it hence produces an erection. Then there are injections that people may use. and those are called intracavernosal injections. The penis has what we call spongy cavernosa, and these normally fill up with blood during an erection. So sometimes medications are injected directly into the penis to induce an erection. And failing all of those fail, then there are penile implants. And these are surgical implants that can help in the penis to provide rigidity when desired. So those are the things that help with erectile dysfunction. And we also mentioned premature ejaculation, right? So premature ejaculation, I think I'll speed up a little bit here because I know Dr. Greene keep mentioning time. So premature ejaculation, behavioral techniques. So techniques, there are a lot of techniques out there, Dr. Greene, for premature ejaculation. Techniques such as the start and stop method, the squeeze technique, these can all help, with ejaculatory control. What you want is to be able to make that neuronal connection between the penis and the brain to say, hey, now is not the time, hold on a little bit more. So these are things that help, and those are the behavioral techniques that can help. Then there's the topical anesthetics. These are creams or sprays. They contain a numbing agent that can be applied to the penis, decreasing sensitization, and as such, the hope is that because of that, they can delay ejaculation. Then there are other medications. There's some serotonin reuptake inhibitors, selective serotonin reuptake inhibitors. We call them SSRIs, and these may be prescribed. They're off-label. I must tell you, they're not like FDA approved for premature ejaculation, but they do help, and sometimes they're prescribed for that reason. I must give that out there that these are off-label use of this medication. And then we talk about low libido.
Can I interrupt you a little bit, Doc? Because
sure, Doc.
I always have to pretend to, well, not pretend, but bear in mind that we have different categories of listeners. So when you mentioned just now, they're off-label, just exactly what do you mean by that?
Okay, so a medication is tested for a certain purpose. The purpose for which it's tested and approved is the labeled purpose. So that medication that I mentioned, the SSRIs, or selective serotonin reuptake inhibitors, they were prescribed, they were studied for and used for, their label is for antidepressants. So that's their purpose. But what was found out is that, they can cause delayed ejaculation. And so if a medication can cause delayed ejaculation and as a side effect, and someone has a problem with premature ejaculation, then this is not the approved purpose of the medication, so it's now off-label.
Okay.
It can be used for that.
Now, I did request a few minutes from my technician so that because I know that people are concerned about treatment, and I want to ask you just to go back a little bit to this matter of the premature ejaculation and things like the squeeze technique, because just to emphasize, you've said so many times this afternoon, the matter of communication and cooperation with husband and wife in dealing with these kinds of things, because these are some things that can be worked on, but they need to be worked on together. So if you can just reinforce that.
Oh, yes, sure. Again, so when it comes to anything that people do together, especially if it's two individuals involved, and here we're talking about two persons who are very intimately involved, right? We're talking about the husband and wife. So the communication has to be there. So each individual knows what works best for them. You know what's your if I can put it this way, what's your pre-ejaculation sensation? You know when you're getting to that point. You can communicate that with your partner. So there's this need for talking. And people, you know, doctor, the amazing thing is that people will tell you what's their favorite color. They'll tell you what's their favorite food. And I'm not saying these things are not important. They are important. But taking time to discuss sexual preferences, and I'm just throwing that out there very broadly. You know, these are things that, you know, that communication needs to be there, and it needs to, you know, and these are things that you can talk, like I mentioned, or you have that date in the kitchen cooking. You can talk about these things while you're gardening, you know, talk about those things. Or you can wait for some, you know, whatever time is appropriate for you. But those discussions are discussions that needs to be had. And so, yes, the technique, stop start, these are manual techniques where, you know, okay, you're starting, you're about to come. There's the squeeze technique. It kind of throws off that sensation and let the brain focus on something else and delays ejaculation. And so it gives you more control. It gives the person who have that problem some more control, knowing, okay, these are the muscles involved. These are the things I need to do so that they can, you know, have that control, ejaculatory control, have some more control there.
Well, thank you so much.
And Doc, I need to throw this in here.
Yes.
I'm not saying that yes, you'll get good after one try or two try. No, absolutely not. This is something that needs to be worked on constantly, and yes, you get better over time, like anything else.
Very well. Now, I do have another question to ask you, but we're going to wrap up now. I want to thank the technician for arranging for the extra few minutes that we have. But just before we close, additionally, I want to let folks know that we're kind of wrapping up this series. We will have some, of course, Let's Talk is always on, you know, but next week we're going to be talking about, during the course of the last month or so, as we have discussed these various issues, it occurred to us that, at least to me, that, you know, a lot of times, especially when we're dealing with issues relating to various of the discussions we had, not masturbation, I mean menstruation and the like, that the concept of even when we spoke about cervical cancer last week, this matter of sexually transmitted disease kept coming up. And it occurs to me that some folks still don't understand the dynamics of sexually transmitted disease. So we have decided that next week we're going to deal with the subject of sexually transmitted diseases to answer all the questions that you have concerning what type, which type, what is what. So that's for next week. But to close off today, Doc, I want to close with the Viagra story. Now, you use the scientific terms, and perhaps you can say why there is a scientific term and there is I don't know if it's the shelf term or whatever it is, but
the generic and the trade name.
Generic and the trade, yeah, that's right. Viagra and Cialis and the others, they have become very common these days. You kind of mentioned how they worked already, but I wanted to ask you about the risk. I remember in the early days of Viagra, there was one ad that said, if you maintain an erection for more than 24 hours, and I laughed at that. You know, and I said, imagine
it's 4 hours, Doc. It's not 24. It should be 4. 4 hours.
4 hours. Okay. Well,
yeah,
whichever way. You know, I said, wow, that's interesting. That's a long time to have an erection. But what are the side effects of these things? How do they work, and what are the side effects? That's okay. Where we wrap up today.
Okay, so I should say that, you know, Viagra is usually, and I'm going to stay with your trade name here. I'm not an official conference. Viagra is generally well tolerated. And so I have no shares in Viagra. So let me just put this out there. No financial disclosures. So Viagra is generally well tolerated. However, it can cause side effects. You did mention one. I'll still touch on it a little bit. So what are some of the side effects, you ask? There's headache. One of the most common side effects occurring in a significant percentage of users of Viagra is headache. And again, we're talking about increased blood flow, and so one can understand that. The next one also same thing, which is facial flushing. I mean, for dark-skinned Caribbean people, facial flushing, maybe not. But some people may experience redness or warmth in the face and neck from the use of Viagra. Another one that may be concerning to you or to user of Viagra is indigestion. So Viagra can cause some gastrointestinal symptoms such as upset stomach, acid reflux, and things like that. So that can be. Nasal congestion, stuffy nose, runny nose, that may occur. You may have some dizziness or lightheadedness. Some individuals do experience those while on Viagra. One symptom, though, that I need to let you know about, and this one is of concern to a lot of people, and that is vision changes. So Viagra may cause changes in vision, such as blurred vision or a bluish tint. Very serious vision changes are rare, but if there's any vision changes, this should be promptly reported to your physician. Very important. Some people using Viagra may also have muscle pain, muscle ache and muscle pain, like back pain you may have. And so those are some of the causes. And Doc, you mentioned one, medically it's called priapism. Priapism is a rare but serious side effect involving a prolonged and painful erection. So, as was mentioned just before I get to those side effects, if one is using Viagra and they experience an erection that lasts longer than 4 hours, they should seek medical attention immediately. I think that, you know, it's very important, and I can't stop here without saying this, that Viagra should not be taken with certain medications. And so, especially, there are some nitrate medications that are used to treat high blood pressure. And so if you combine Viagra with those, they may cause a dangerous or precipitous drop in the blood pressure. So I would advise that before using Viagra, I know you can probably order online and get it discreetly to your door. But before using Viagra, I would advise individuals that you should talk to your doctor, talk to your physician, talk to your primary care person who's providing you with that health, and let them know about the medications you're taking. Let them know about your medical history as well. And discuss those before you start using or taking Viagra. It's very important.
Well, thank you so much, Dr. Thorne. We appreciate the wealth of information that you have shared. Again, you know, our purpose here is to sensitize people, to bring awareness, so that folks do understand the dynamics involved. And I trust that husbands and wives will continue this discussion, and will follow some of the suggestions that were made. You know, the communication matter is so very important. But as you know, we have gone over time by just about 15 minutes or so. Again, I want to thank the media team for making that adjustment in the program, but we have to stop.
So, Doc, if you give me one more second, yes. I just like to bring this all to a complete, like, you know, and end it there. And so, one thing I think is very important, that everyone leave here understanding this. Adopting a healthy lifestyle, including regular exercise, balanced diet, avoiding excessive alcohol, tobacco use, this can improve your overall health as well as your sexual function. It is crucial for everyone or anyone who is experiencing sexual dysfunction to seek guidance from a healthcare professional. Treatment plans are often individualized. I've mentioned a lot of stuff, so know that. It is individualized based on specific circumstances and the causes of the dysfunction. Again, I can't overemphasize that open communication with your partner, with your therapist, with your healthcare physician, doctor, whatever, whenever applicable, all these things is very essential in addressing sexual health concerns effectively. In many cases, in a lot of cases, this is a multidisciplinary approach, and it needs all those people to come together, including yourself. Bring all those people together. Don't leave your wife out. Don't leave the therapist out if you have one. Don't leave the doctor out. Get everybody together, work on this as a team, and I'm certain that there is some hope at the end of the current tunnel that you're going through.
Well, thank you so much, Doc. That's where we end the broadcast for today. We appreciate the information, and to our viewers, thank you. And we know some of you were very happy for the extra time.
Thank you, Doc.
That's all for today. Until next week.